Are you struggling with the relentless pain of sciatica and wondering when it's time to seek professional help? Sciatica can be confusing, ranging from a mild annoyance to a severe, debilitating issue, leaving many unsure about the best course of action. It's essential to know when you can manage it on your own, when professional help is beneficial, and when it becomes mandatory for your health and well-being. I've seen countless individuals transform their lives by understanding the right steps to take at the right time. This video will guide you through clear and concise strategies that offer safe and effective solutions for sciatica. We're going to cover 3 critical scenarios. Number 1, when you can handle it on your own. We're going to learn some simple exercises and lifestyle adjustments that can alleviate mild sciatica pain. Number 2, when professional help is beneficial. You'll discover the signs that indicate you need the guidance of a healthcare professional to avoid worsening symptoms. And number 3, when professional help is mandatory. You're going to recognize what we call red flags that necessitate immediate medical attention to prevent serious complications. By the end of this video, you'll gain a clear understanding of how to distinguish between minor sciatica issues and more severe conditions. You'll learn practical tips and new approaches that are both effective and simple to implement. My goal is to provide you with clear, concise, and actionable information. By the end of this video, you'll have a comprehensive toolkit of safe and fast solutions to manage your sciatica pain effectively. Whether you're dealing with a mild annoyance or a more serious issue, you'll know exactly what steps to take to find relief. Stay with me and you'll discover the key to managing your sciatica pain and improving your quality of life. Hi, I'm Dr. John Zalonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. I upload a new video every week. In addition to that, I created a free Health Vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. So what exactly is sciatica? Well, your sciatic nerve is a very thick, big nerve that goes down the back of the leg. It actually comes from the various vertebrae in the lower part of the back, and each of what we call these nerve roots actually come together to form the sciatic nerve. Unfortunately, when that sciatic nerve is irritated, and that can come from anything from disc herniations, osteoarthritis, trauma, and so forth, you're not going to like that. You're going to get anything from sharp pain to electric shocks down the leg to numbness or tingling or burning. All depends on the extent that it's happening in you. Now, when you can handle this on your own is when this is a mild case. So we're going to do some very simple things to try to deal with that. So number 1, we're going to do some simple exercises. So simple exercises, these are going to be gentle stretches for the lower back and for your hamstrings as well. So you may do something, for instance, like a piriformis stretch. So you can find these in our other videos, but if piriformis stretch, the piriformis muscle actually comes across the back here and attaches right across the back of the hip like this. So a piriformis stretch would be one you'd be lying on your stomach and literally the lower leg is going to go outward, such as that. That can start to take some pressure off a tight piriformis, which may be compressing that sciatic nerve. You can do what we call a sciatic nerve floss. So this would be one where you'd be lying on your back, use a towel to grab the leg, and basically you're pulling the foot back towards you. Again, you can see this in our other videos. You're trying to get what we call a flossing of the nerve to release some of that tension off there as well. You can do pelvic tilts. So pelvic tilts, obviously this is the pelvis. So pelvic tilt, whether you're doing a forward or a backward pelvic tilt. So for you, this would be something where you're going to be lying on your back and you'll either push the small of your back against the floor or you'll do the exact opposite movement again, depending on what's caused the sciatica. So these are all simple stretches you can try at home. You're going to want to look at some lifestyle adjustments or changes. So this is where proper posture becomes important. If you've got terrible posture, you're putting excess pressure on those nerves all the time. That's going to aggravate the sciatica. You're going to want to make sure that your ergonomics are set up well at your workstation. Again, we have a whole video on that for you. You want to make sure you're in a good sleeping posture. So sleeping posture is one where you want to use 2 pillows, one for the back of the neck, an orthopedic pillow, And then the second one for the lower back of the legs, where if you're lying on your back, that pillow should be underneath the thighs. If you're on your side, that pillow should be between your thighs, between the knees. That helps to take some pressure off the nerve as well. And then there are a number of self-care tips you can use. This is where you might be using ice or heat. When there's inflammation, you always want to go ice. I know everyone likes the heat. Ice is better when there's inflammation. Heat is when it's tight muscle and only tight muscle. So almost always better to start with ice as far as that goes. And then just incorporate some low impact physical activities like walking or swimming as well. Now, if it progresses beyond something that you can manage yourself, this is when professional help is beneficial. So the signs that you need or really should seek a health professional are going to be persistent or worsening pain despite all the self-care that you've tried. Pain that starts to radiate down the leg below the knee. When it comes below the knee, that's a far more serious sign. If there's any numbness or tingling or pins and needles, or if you notice any muscle weakness in the leg as well, you can try a number of different health professionals for sciatica. Obviously, chiropractic care is excellent for this because the goal is to get right to the underlying cause of the problem and take the pressure off the sciatic nerve. Not to mention a whole number of different exercises, other different techniques that can be incorporated as well. You could try some massage therapy, some physical therapy. Again, they're going to be looking at things, massage, obviously, the more they can ease up the muscles, they should help with taking some of the pressure off that area, or certainly give at least temporary relief at best. Physical therapy, you may be looking at anything from ultrasounds and interferential current. They may also get into exercise as well. Acupuncture can have some benefits for some people as well. So people are familiar with acupuncture or the insertion of the needles, again, to try to ease up the area to restore energy and so forth. There are medical treatment options as well. So typically that's going to be a variety of different drugs, anything from muscle relaxants, painkillers, anti-inflammatories. You need to be careful with these because yes, you want to break the pain cycle. Unfortunately, all of these things do have their side effects, and long term, they're really not fixing the underlying cause of the problem. So if you're someone who's been living on any of those long term, you're actually often allowing the condition to get worse. You just may not be feeling that it's getting worse. There are corticosteroid injections as well. That's a little more on the serious side. And again, they do have their side effects as well. That brings us to the last category where professional help is mandatory. And so when I say mandatory, I do in fact mean mandatory. This is what we call in healthcare, what we call red flags. So red flags are warning signs that you need to take action. So this is when you're getting severe, unrelenting pain. When you could get sudden, severe leg weakness. Remember, all the muscles are controlled by those nerves. So if there's a tremendous amount of pressure on the nerves and you actually lose the ability, to have muscle strength, that's not a good sign at all. Understand those same nerves go to any of the organs in that area. So they go to the bowel and the bladder and the reproductive organs. It's what we call cauda equina syndrome. It's something where if you lose bowel or bladder function, don't call me, you're going straight to emerge. This is often emergency surgery. You've got to get that pressure off the nerve. You cannot lose bowel or bladder function. These are things that require immediate action on your part. And when you get to the hospital, let them know exactly what's going on. And you can expect that they will take immediate action in most cases. So by now, you should be able to distinguish between what we call a mild annoyance versus some serious long-term issues. So one of the keys to this is understanding the symptoms, as we've discussed. You need to differentiate between occasional pain versus chronic issues. You should be monitoring the symptom progression. Are you finding that each time it comes back, does it tend to be triggered off easier? Is it something that gets worse, is more intense, more frequent when it happens? That's basically an indication that you've got a progressive condition going on and that you should seek good professional help to slow that down as quickly as possible. You need to have some long-term management strategies. So that could be regular checkups with healthcare providers. Always an excellent idea based on the science and based on all the clinical case studies to have some type of chiropractic maintenance program or plan as well. You can help keep the body at an optimal level. That'll help prevent some of these things coming on in the first place as well. You need to make sure that you're making the necessary lifestyle changes to also prevent any type of reoccurrence, whether that's posture, ergonomics, nutrition, exercise, and so forth. You now should have a clear understanding of when to seek professional help for sciatica. Remember to use simple exercises and lifestyle adjustments for mild pain, consult professionals when symptoms persist, and seek immediate help for severe cases. Take some proactive steps to manage your sciatica and improve your quality of life. Effective solutions are available, so stay positive and proactive. Now it's your turn. I'd like you to share your experience with sciatica leg pain in the comments below. How has it affected your life? What treatments have you tried? What worked for you and what didn't? By sharing your story, you can help others in our community who might be going through similar challenges. Please support each other on the path to pain relief and getting back to optimal health. If you found value in this video, please go ahead and like it and share it now so we can help more people suffering from sciatica. Be sure to subscribe if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and surgery. The next video you should watch is this one here if you want to discover a revolutionary non-surgical method for treating sciatica, disc injuries, spinal stenosis, and radiculopathy. Please go watch this video next.